Those global funds, and at the last count there was something like 80 international bodies, not necessarily in South Africa but globally, who have contributed to the fight and the control of HIV/AIDS, and that has been an unprecedented investment in health compared to any previous period, any other disease. So it has been quite an important event globally. For South Africa, it's been also very important, and I'm particularly impressed by the scale of the contributions by, say, PEPFAR or the Global Fund, etc. And I think it's made an impact. I can't give you, and I don't think anyone can give you a percentage or a proportion, but it certainly has made an impact, in particular in terms of antiretrovirals provision. It's made a great impact. But there's still a long way to go. I think, first of all, there is much more to do, and to put it in some context, it's not like we've conquered the epidemic. You know, every day in South Africa it's about, 800 new cases. Globally it might be 6,000, 800, 7,000. The figures don't matter, the precision of the figures don't matter. Is it big or not? It's massive. And so these things are happening every day. Men are getting infected, children are dying, and so on. So we need much more of an effort. At the moment, about maybe a third of the people who should be getting antiretrovirals, adults, are getting them, and about a third of the women who are HIV positive and are pregnant, and if we gave them antiretrovirals, it's almost as good as a vaccine because it prevents infection in the babies, and only a third are getting it. So we need to scale up twofold. What's keeping them back? I don't know, but it's not unusual for the industrialized countries not to keep to their promises. Up to now, in the whole history of our attempts at dealing with the fundamental problems of inequity and poverty and the other structural components, which are also important for HIV/AIDS, we've had a real battle. I mean, everyone knows about global debt and the failure to provide money for development and so on and so on. So that self-interest also gets in the way. But as I said, at least for HIV/AIDS, there has been substantial contribution. AIDS in many parts other than a part of southern Africa, and if you look at a crescent which goes up to Sudan, outside of that it is not the major killer of either adults or of children. So those people are really concerned that when they look around, where's the money for research, where's the money for services? It seems to be only for HIV/AIDS. So I have sympathy for that. I think in South Africa the issue is slightly different. We do have the worst epidemic in the world, so we have to tackle it in a way which is commensurate with the scale of the epidemic and the depth of the epidemic, and we're trying to do that, and we've only partially succeeded. So it is an epidemic the likes of which, to my mind, humankind has never seen before. We are sitting in the very heart of the beast, and we should be making extraordinary efforts. But I can't see how you can counter funds for HIV against funds for TB. The two go hand in hand. So the two are not separate. They shouldn't be separate, and they should be treated as one problem. Malaria is frequent in this country, but it's not of the same magnitude as HIV or TB. So the funding, therefore, will be less. But in the event, why should we make choices? Why do we? Three major killers. Child health is affected by at least 2 or 3 of them. Why do I have to make a choice between these diseases? It's almost criminal to ask us to make such choices when we have got money. And when you ask specifically about South Africa, I'm not speaking about the other poorer countries. I think we've got the funds. Absolutely. I think we have the funds to provide the sort of care that people with HIV need, and people with tuberculosis need, and kids mostly, but others too with malaria need. And the fact that we have one of the worst epidemics of tuberculosis, in addition to HIV, one of the worst, and in my province, in a place called Tugela Ferry, is an indication of what people often ignore. It's an indication of the failure of the health services to provide care for a curable disease. Now we can't allow that to happen, so there's no question of a choice for TB against HIV. It must be both.